go back home after the treatment, pain comes back. For example, tennis elbow or even lower back impingement. So let me tell you about the difference between chronic pain and acute pain. Chronic pain is, I gave the example of play football regularly, you feel that tightness in your legs, but you choose to ignore it, tightness suddenly, out of nowhere you have this, after a few months you get this niggling pain in the knee, and this niggling pain in the knee doesn't seem to go away. So that's knee pain, right? But this is chronic knee pain due to playing football or doing something that is repetitive in your daily living. Like for example, sitting down for too long, and then, you sit down for too long, 7 to 8 hours a day, you're on your computer, then you get lower back pain or you have neck pain. Pain just comes gradually. First is a tightness, then you ignore the tightness, then it becomes a pain. Then you take painkillers because of the pain, and then you get a numbness, which is a nerve impingement down the arm. That's chronic because it's a build-up. Whereas in acute pain, is you play football and someone tackles you from the side and you have an ACL tear, or you suddenly have this twist of the knee and you had an ACL tear. There is a relationship between chronic and acute pain, because whatever is chronic can become acute if you don't look after it. For example, when you're at the desk sitting for too long, every day, you're sitting in this posture rounded back without using an ergonomic chair, you have that tightness in your neck, and you ignore the tightness in the neck, or you take medication to just numb it off, and this tightness becomes a pain, and you still continue taking medication. Then that pain becomes a numbness down the arm. So now that numbness down the arm is because of a nerve, and the nerve is not being impinged due to the spondylosis or a spondylolisthesis, which I mentioned before, in the neck, when the vertebrae impinges on the neck, because due to weakness imbalances in your muscle in your neck. That's an acute impingement resulting from chronic tightness. So for example, recently I've got a lot of cases of tennis elbow. After treatment, 10 or 15 minutes come back. Why? And usually people who come to see me is they've had this already for a few months, right? The inflammation has been there for a few months. So there's already, like in medical terms, we call it tendonitis. And you feel the arm like the pain is right down here. And this is actually the pathway of the radial nerve. So they already have a radial nerve impingement. So there was chronic tightness in the beginning. And chronic tightness results in the impingement of the radial nerve because the muscle sits over the radial nerve. And the muscle becomes tight and the radial nerve gets impinged. So the normal size of a radial nerve maybe is this size. So now that it's impinged and it swells up, becomes double the size now. So just imagine it's double the size, the muscle is tight, and the radial nerve also innervates the muscles around it. And so it causes a vicious cycle where the irritated nerve causes a greater tightening of the muscle around that nerve. And the nerve gets impinged more and it gets even more inflamed. So that's a vicious cycle. What ART can do, especially in chronic pain relief, is to get the muscles to slide, to get the nerve to slide past the muscle, underneath the muscle. However, don't forget the nerve is still inflamed. And ART cannot help with acute inflammation. So that's why we have ART is still considered allied healthcare. We need to work with the doctors, where the doctors can give you medication in order to relieve the inflammation, as well as to reduce the inflammation on the nerve. So you have Lyrica that helps with the nerve, right? You have muscle relaxants which help with muscle strains, right? You have also got like painkillers usually have a double effect, killing off the pain as well as anti-inflammatory like Acoxia, which is very common to help the reduce pain. So you usually need to take a course about 8 to 10 days concurrently with the treatment. Firstly is to reduce the inflammation on the nerve so that the nerve goes back normal size so that it can slide better. And then the ART treatment is to get the muscles around it to unlock, because once there's pain, scar tissue form, adhesions form over the muscle, right? Because it's tight, it's contracted, not enough oxygen going in the muscle. So ART is meant to release that muscle to get it to slide, because the lack of slide causes mechanical failure that results in pain. Then, with the help of medication to reduce the nerve inflammation, then it's going to work. A lot of you come to see me, you have gone through the mill. You've gone to see the physio, you've gone to see the chiro, you've gone through all those doctors. However, the pain is still there. That's why you come to see me. However, you have to listen to my advice. When I tell you that is both chronic and acute, take medication. Please take medication. Don't treat Western medication like some kind of anathema. It's there to help you. It's there to work. Of course, you don't take it long term. You need to have a strategy when you take it. Okay? So I work with doctors, especially when it comes to when the injury has got both acute and chronic pain. Follow that strategy and you will recover. Don't have a piecemeal approach. Listen to me one bit, and then you don't listen to me another bit. Okay? It's like, you're on the operating table. When operation is only half completed, you get off the table. So wait for the operation to complete. Then get off the table and you will definitely recover from this. Okay? Thank you.